Welcome to the Syneos Health Podcast, Conversations on Commercialization. I'm Tyler Cowan, Vice President Commercial at Syneos Health. In this series, my co-hosts and I are having discussions on how biopharma leaders are rewriting the commercial playbook and what it takes to succeed as commercialization takes on a more strategic role earlier in product lifecycle. We're sharing cross-functional perspectives on the decisions shaping commercialization today, from value and access to evidence, stakeholder strategy, and engagement planning. Enjoy this episode. We're glad you're here.
Hi, I'm Chris Van Denberg from Syneos Health and your host for this episode of the Syneos Health Podcast Conversations on Commercialization. We're recording from the floor of the Asembia Summit 2026, where the industry gathers to discuss the future of specialty pharmacy, prescription access, and patient care. Today, I'm joined by Micaila Ruiz, Optum VP, Clinical Operations, Pharmacy Care Services, formerly VP of Specialty Franchises. What was the transition?
I was inside the specialty pharmacy business proper, where I had responsibility for key therapeutic areas, oncology, neurology, immunology, rare and orphan diseases. And an opportunity came my way where they said, listen, we want to lead and be more attentional with our clinical programming. We are creating a new hierarchy around clinical operations that will span the Optum integrated pharmacies. So think home delivery, specialty, Genoa, infusion. And I love my job. I loved my job that I had, but it was so compelling to say, we're creating a new team. I am a pharmacist. I am a clinician. We're being intentional about leading with clinical. And it was just, I pinched myself. It's too good to be true. And I could not pass it up. So 45 days in, learning a lot about the other businesses, but getting very excited about what this will do to empower our people. Sometimes I think clinicians and organizations like specialty pharmacies, they're maybe limited on their mobility. As you get higher up in the organization, you get fewer and fewer clinicians. And I think that's normal. We don't tend to go to school to be in business or finance typically. Some of us do, but I think it's going to be great career pathing and development and a way for us to have people move both laterally and upward. And I'm excited about those opportunities. So thanks for asking.
Why is it happening?
To be better coordinated and provide more holistic care to patients. We want to make sure we're thinking about patients holistically. It's not a specialty patient, it is a pharmacy patient. A patient is a patient. If I'm talking to somebody about their specialty medication as a part of our core clinical services, and I know they utilize our home delivery pharmacy as well, and they're on medicine for diabetes, they're a type 2, there's no reason why I shouldn't be asking, when I have them on the phone, for something else to say, hey, I see this in your profile. When's the last time you had your A1C checked? We just didn't do that. And so I think we're creating some efficiencies for both providers, patients, clearly. They've got some of those synergies that are very clear. It just gets to the heart of, we saw a missed opportunity to elevate the care we're giving patients and also to really drive home the value that we know we have that maybe we haven't unlocked. And we had to say what needs to be true or what needs to be different to unlock that.
That's a fair point. And I suspect that feeds directly into access, affordability, and outcomes. Mm-hmm. And so what are the most meaningful opportunities right now as you see it to improve that access and the affordability for these cancer patients?
It was an amazing panel with Tina, and we're so thankful for the opportunity to work with her. I've known her for almost 11 years now. And she's a wonderful, wonderful person who at her core is somebody who mentors and is a mentor to people and is always, always supportive of people. And she just gave us that opportunity. And it came up organically. And I said, would you be willing to sit with me and someone else on my team and really get into this? We want to hear all of it. And she did. She was very, hey, this isn't just you, this is the system. It was just an amazing opportunity to get regrounded, to say to ourselves, okay, we thought that was amazing. We thought this was going to work out really well, but it's not landing right. And we have somebody that's saying, this is disjointed. The example she gave about the patient education, it gets me every time.
One second, let me sort of catch everybody up here. Micaila and I and Tina Valb and Austin Fisher were on a panel about half an hour ago at Asembia, and Tina was talking about a number of things where she's experiencing a cancer journey, and there's things that happen along these journeys that aren't always perfect. So we talked a lot about the different areas in which the various stakeholders can come together to collaborate on a better patient not just care experience, but even outcomes, not just clinical. Survivorship is a big deal. Going through the journey is a big deal. And so the example that you were just bringing up is where Tina was talking about receiving a medication in the mail and having 5 different pamphlets in there from 5 different stakeholder groups that didn't necessarily coincide so well.
She had something different from her provider in a medically integrated type of environment. She had something different from the pharmaceutical manufacturer. She had something different from the specialty pharmacy. She had about 5 different areas that she was getting information from, and it was disjointed. And again, she is a pharmacist. She's very well versed in this area. And she's like, I'm confused and I have questions. And so that was one of the things that came up in our conversations. It never occurred to us that there would be these inconsistencies. And what can we do about that? So while we were here at this conference, we reached out to someone who was well known in the industry, a nonprofit, and just said, hey, you guys have great education and materials. We'd like to learn a bit more and get more aligned and see how we can get those two to be more consistent. And jokingly said, we've got 2 out of the 5. We're going to keep working on the others. But those are small things that have really big impacts. And so I think as we're approaching how we're taking care of and ensuring that patients are successful in their therapy and in their journey, that we're thinking about those types of things.
There's just so much confusion for a cancer patient and their caregiver.
100%.
They don't even know what to ask for.
Correct.
Do they know how to ask for it?
And imagine asking for it, and then it's like, but my doctor said something different.
Right. So in order to make those changes, you had to listen, and you got a few phone calls
Yep.
from Tina, right?
Yep.
And if you've known Tina this long, she obviously thinks very well of you, which means by default you're a listener. How did you get your team, group, who started listening?
It started with Tina. We both had that relationship, and that was sort of the conduit. And I think she would say this if she was here. She's like, I don't know why I didn't think we know each other. Why didn't I reach out? Why didn't I do that sooner and just have the conversation? So that, again, going back to the panel of encouraging people to speak up. And in that instance, it was just maybe we weren't thinking about having that conversation. In other instances, it's thinking people aren't going to be receptive or they're not going to be willing to listen. So it started there. And then I felt like this really needs to be taken forward. We all need to hear it. I had Becky Farah, who heads up our Center of Excellence for Oncology and our franchise for oncology, brought her along, introduced her to Tina, and we listened to that information. And they were great. We pulled all the calls. There were things that went really well. And then you could hear the frustration and just the tiredness sometimes too. And how she presented to us really made us stop and think about all the things that she was experiencing before that. It was a good lesson for us to say, we got to think more deliberately and intentionally about what's happened with this person prior to the point that they engage with us.
Tina's one person.
Yep.
Have you extended that out to listen to other recordings or look at other whatevers you look at?
Yes, we have. And I think it's something we always did, but I think we don't need to wait for something to go off the happy path, if you will, before we start to look into it. So I think we were much more intentional about doing more listening sessions, checking in, and we have a fantastic team that will help us and did the same thing for Tina's feedback of mapping out an entire journey, at least within our ecosystem, and then doing a good job of pulling in information from Tina that was giving our teams context about what happened before, what's happening after. Because I think sometimes we tend to focus on the thing that's right in front of us. And she hit on in that panel as well about know where your handoffs are, know what you're responsible for, but know what's the next part of it. So it started with a couple of us, but we have amazing people. We have amazing clinicians that everybody wakes up and they want to do well. They want to make a difference. And it was just incredibly moving and powerful to see everybody rally as the span of influence grew and brought more people in of just, we can do this. It's not rocket science, it's the simple things, and they got really excited about doing it.
My organization works with manufacturers, and there are people that specialize in our group on patient support programs, services with manufacturers. From your perspective, what are some things that we need to make sure we're guiding those manufacturers correctly in those patient services programs, whether it's working with their SP network or a hub? What do you see?
That's a really good question. I think for me, how they set those up, some companies do a better job of this than others, but thinking about how you educate your SP to understand this is what we're doing with the doctors. This is what we're doing for patients. So better awareness. Everyone does a great job of, hey, these are our support programs. This is how our hub works. These are all the things. But I think they could maybe take a step back and say, knowledge is power. And if I empower the SP and I empower everybody in that ecosystem that's in their network and how we're looking at network access, if we're all better educated on what each other is doing, what we're presenting to the patients, that only makes us better. And I think sometimes we just really get it in silos of, we need you to execute on this program, we need you to do this thing, and these are the data fields that we need, and so on and so forth. And I don't mean to paint with a broad stroke. Some pharma partners do a really good job with that. Others, I think, could benefit from some other best practices, but I think setting everyone up to be successful, because she talked about those handoffs and how patients get lost in the handoffs. If we're not fully aware what's happening before, after, and maybe in parallel with what we're doing, we're missing an opportunity to do better by patients and understand we have an opportunity in front of us. It's not just about ensuring patients get access to meds. Patients say a lot of things to us. They're comfortable sharing with us as pharmacists. We hear things, and you hear something, do something about it. And if we hear those things and we know how it should work, we know what's supposed to happen, we can recognize that it's not, and how do we facilitate getting that person to the right spot or helping to solve the problem. That knowledge, back to the challenge with our other partners in the ecosystem, that's helping everyone feel empowered to be at the absolute top of their game, top of their license, top of their game, and they feel empowered. Knowledge gives them that confidence, that empowerment, where maybe if they don't know all of those things, they're going to maybe be hesitant to say something because they're not sure if that's the right thing.
I have to imagine there's also a strong element of internal culture.
Yes.
So knowledge is great.
Yep.
Doing something with it, I think, is based on culture.
Yeah, 100%. We're talking a lot from the very top down, and infusing that throughout our organization is really focusing in on our culture, on our people. And without that, it's really hard to do the hard work, to be very direct. If the culture is not right and we're not focused on the right things, if you listen to earnings reports and things like that, we call out the investment back into our people, back into charitable organizations, our foundation, and what we're doing. And so I think that's a great shadow to cast, that it starts at the top and it goes across the organization, and we all feel empowered to do our part.
Maybe the spark starts at the top.
Yeah.
I think the wood and everything that makes the fire is already there.
It's already there, yeah. You need that accelerant or something to start.
Yeah. Today in our panel, we started out asking everybody in the audience, if you've ever cared about a patient, if you've ever put that patient in the center, just like we talked about, please stand up.
Yes.
Obviously, everybody stood up. That's prevalent in all of our organizations. And when we do get overwhelmed and stressed and distracted, sometimes the handoff doesn't go perfectly. It's inspiring to hear what you guys are doing.
Well, thank you. Yeah. We're not the only ones. We're out there, want to share what we're doing and make sure that we're maybe that spark too. We're saying to people, hey, this can be done. It doesn't matter the size of your organization, big, small, medium, everywhere in between. These are all things that we can do, and then they have impacts, that butterfly effect.
Yeah. Like we discussed in preparation, change can happen.
100%. You challenged me on that. What's one thing you would challenge the audience? And I said, reach out to somebody that you probably normally wouldn't think it'd be somebody that you'd work with, or would even maybe perhaps be receptive to working with you. And before I even left, and I think she interacted with all of it. Like, I think she came to each one of us, but she came up and said, hey, I'm at XYZ company. We're kind of in the same orbit. I'm taking you up on that. I think we should chat, and what can we do?
And this all leads to a future, a better future?
Yes.
What does that look like?
I'm excited about the future. I think there's buckets, right? How you think about it, all the advancements, all the great things that are happening from therapies. And you think about certain cancers where you had maybe one or two things, and if those stopped working, there wasn't anything else. Now you're getting more third, fourth line. There's more things. It's not the end of the road, and it's not, there's maybe a clinical trial, maybe not. Then I think about what's being done with genetic testing and how you can get the biomarkers identified early that completely change the trajectory of your treatment. You also think about these more targeted therapies, not necessarily on a personal and your biomarker, but what we're able to do, like CAR T therapies and other things. The future is very bright, but I worry that if we don't take time to think about, is the foundation strong? If you build your house and you have all these fancy add-ons and the foundation isn't great, you're gonna have problems. And so I think we've recognized in the ecosystem, there's challenges, there's complexities. And so that doesn't get any easier for patients as you get these more targeted, complex, and unfortunately, as they come to market, expensive therapies. It's getting the fundamentals and the foundation to make sure that we're able to manage and really help patients be successful on those therapies. The future is also looking, and thank goodness this is a thing and this is real, is that in some instances we're starting to look at cancer as a more of a chronic condition. And that's amazing. People are living full lives and they're managing that more along the lines of a chronic condition. But that just means our systems need to evolve too, to think about how we change and adapt to that it's going to be more chronic. Maybe the touch points look different. Maybe where they're accessing their medications looks different. And then there's certainly the burden and the cost associated with it to make sure, people's insurance changes over the course of a year. Their eligibility might look different, things of that nature. It's a wonderful thing that more patients are living longer, but are we ready as a system to manage that and support it the way it needs to be?
Because survivorship is already difficult.
Yes, we don't need to be a part of that difficulty.
Well, Micaila, I can't thank you enough for joining our podcast today.
Yeah, thank you so much.
I learned a lot. Our audience will definitely learn a lot.
Yeah.
And it's been a pleasure to work with you.
Likewise, and really appreciate the opportunity to share some of the things we're doing, and hopefully this reaches some other partners that will hear this and reach out, and we'll continue to do the good work that Tina has challenged us all to do.
That's it for this episode of the Syneos Health Podcast, Conversations on Commercialization. Subscribe wherever you get your podcasts so you never miss an episode. If there's a topic you'd like us to explore, send us a message at podcast@syneoshealth.com. For more actionable, future-focused life science insights, visit the Insights Hub at syneoshealth.com.